Now, over 50% of runners experience insertional or mid-portion Achilles tendinopathy. However, new research has also found that 20% of patients with mid-portion Achilles tendinopathy actually have plantaris tendinopathy. Plantaris muscle involvement will change runner rehab, and clinicians should be familiar with the signs and symptoms. So let's identify what those are. So the signs and symptoms for runners with plantaris-associated Achilles pain are going to note that they have pain at the medial aspect of the Achilles tendon at the mid portion. That's the first thing. The other thing is going to be that they have worsening pain loading into dorsiflexion. So whether that's standing or using dorsiflexion range of motion under load, those things are going to be painful for them. And then lastly, another inclusion criteria is going to be that they have failed to respond to a progressive Achilles tendon loading exercise program. So what are some of our clinical pearls? 20% of mid-portion Achilles tendinopathy patients actually have plantaris tendinopathy. Plantaris muscle involvement is painful at the medial Achilles mid-portion and worsens with loading into dorsiflexion. Clinicians should avoid dorsiflexion loading exercises early in recovery for runners with plantaris involvement. And runners with plantaris-associated pain should avoid hills, consider shoes with high heel drops. So let's break this down and look at the anatomy of what the plantaris is, where it is, and why it might be causing pain. Well, the anatomical position of the plantaris is very, very close to the medial Achilles. Therefore, it's common for runners with excessive plantaris thickening to have medial Achilles pain. And as you can see here, identified in this picture, here's your plantaris going right on the medial aspect of the Achilles. As you can see, it comes down the lower leg and goes right next to the Achilles. Now again, those are going to be areas that are going to be painful, and this is one of the reasons we oftentimes don't think about the plantaris because it's not really used that much. Some people don't even have it. However, it's really important to identify here that this is a muscle and a tendon that potentially is causing problems. So there's several theories behind why plantaris-associated Achilles pain has symptoms for runners. Now, the plantaris can either compress and shear against the Achilles and cause some inflammation, or potentially the patient has developed an isolated bout of plantaris tendinopathy. Now, those are all viable theories of why they might be having pain. However, we do know that plantaris tendons that have increased thickening and widening have an increased chance for that medial Achilles pain. Now, to diagnose this, we talked about the best inclusion criteria. However, it's also important to note there is some diagnostic imaging you could do here. I won't go into this in much detail, but there's MRIs and ultrasound imaging to diagnose medial Achilles pain. The imaging gold standard is going to be ultrasound tissue characterization, UTC. And that's going to provide a color-coded image like you can see here in this middle of the screen. Now, the color-coded is going to help to identify where the inflammation is. It's going to give you more detail. And for this, especially since that medial Achilles is such an intricate area, that's going to be really, really important. So runners with plantaris involvement will definitely have key changes to their rehab programs. And I want to take you through what those changes could be. Now, first, let's just back up a second and identify what rehab for Achilles tendinopathy is. And we do know progressive loading exercises for Achilles tendinopathy have been really well researched. Now, evidence supports exercises such as seated double leg heel raises early in rehab, and it progresses towards single leg hops in advanced stages. Now, for a full list, go ahead and check out runner resources. It will give you a progression and an evidence-based progression of Achilles loading exercises. But I want to point out where these are going to be important for plantaris involvement. And that's really going to be when you're using weight-bearing in-range dorsiflexion. Now, this movement will cause symptoms, flare-ups for runners with plantaris muscle involvement. So what does that mean for us? Well, the research is still emerging here, but the emerging research that we see is showing that clinicians should avoid dorsiflexion loading exercises early in recovery for runners with plantaris pathology. Instead, start by strengthening plantar flexors from ankle neutral to plantar flex positions. So this could be even plantar flexion with the TheraBand. That could be progressed to isometric weight-bearing plantar flexion. It could be toe walking with weight. All those things can be used for rehabilitation here because we are not using that dorsiflexion range. Now, before progressing, then you want to go into your dorsiflexion range of motion. And again, you want to add a lot of load into that plantar flexion range before you get to the dorsiflexion range. And we do know that heavy, slow resistance is most effective for rehabilitation here. Now, based on patient tolerance, we want to slowly progress the exercises into dorsiflexion. Now, continually monitor the runner for pain and symptoms provocation here while you're increasing the dorsiflexion, because we want to be cognizant of whether they're getting issues or they're having a flare-up. Now, practitioners should also consider the running terrain a runner is using if they are running during rehabilitation. Now, early in rehab, it's important to limit running duration, frequency, and intensity to reduce symptoms. However, in later stages, hill runners with plantaris involvement should be advised to avoid those hills until they can tolerate that loading into dorsiflexion. Additionally, we do see research supporting modifying running shoes. The plantaris-associated pain is going to show that a higher heel drop is going to be helpful and could potentially reduce symptoms. However, with some patients with the medial Achilles pain, they don't improve with conservative treatment. Well, luckily, we have options. Now, surgical interventions are considered for those patients, and clinicians should be aware that there's 2 surgical techniques that are used. Both Achilles tendon scraping, which is going to be a removal of the adipose tissue on the medial border of the Achilles midportion, is successful. And then a plantaris excision is going to be helpful as well, and that's going to remove the plantaris tendon. Now, both procedures nearly have 100% success rates, and they require minimal rehabilitation afterwards. So they should certainly be considered. However, referring to a surgeon to be able to evaluate that is the best steps there. As you can see here, there's a lot new info that's coming out, and I just want to share there's a bunch of resources. You can go ahead and click on all the links and different resources if you have questions about all these articles. Until next time, my name's Justin. I look forward to seeing you soon. Ask me any questions you have about this. Please, I love talking about this stuff. And until next time, I'll see you soon.